If you have to be standing for 6, 8 or even 10 hours a day, your veins are under attack right now and you probably don't even feel it. And here's the scary part. By the time you actually see a varicose veins bulging out of your leg, the damage has already been building for years, silently, invisibly, and at that point, reversing it becomes much harder. But here's the good news. I'm a vascular surgeon with over 20 years of experience treating thousands of people and patients with vein disease, and today I am going to give you my personal 7-step standing survival plan. These are the exact micro moves I teach my own patients who stand all day. Teachers, nurses, surgeons, factory workers, shopkeepers, and even you housewives, anyone on their feet. And move number 6, most people get it completely wrong, and it's actually making their swelling worse. But before I give you the plan, you need to understand one thing: why standing destroys your veins. Because once you understand this, every single move in this survival plan will make perfect sense. Think of your leg veins like a vertical pipe system. Blood has to travel all the way from your feet back up to your heart against gravity. Now inside these veins, you have these tiny one-way valves. Their job is simple: to push the blood upward and stop it from falling back down. But when you stand still for hours, gravity keeps pushing the blood downward. And those tiny valves are under constant pressure. Over months and years, they start to fail. Blood starts pooling in your lower legs. The pressure builds up inside these veins, and that's where the damage starts. Swelling, heaviness, spider veins, and eventually those twisted, bulging varicose veins. And here's the key insight. Your calf muscle is your body's built-in blood pump. Every time your calf contracts, it squeezes those deep veins and pushes the blood upward. But when you stand still, that pump is switched off. So this entire survival plan is about one thing: keeping that pump running even when you are at work. So let's begin. Move number 1, and this is the single most important move in the entire plan, that is calf raises. Every 30 to 40 minutes, I want you to do this. Lift both heels off the ground while keeping your toes planted firmly. Rise up on your toes, hold for 2 seconds at the top, and then slowly come back down. Repeat this 10 to 15 times. And what's happening inside your legs when you do this? Your calf muscle is squeezing the deep veins like a fist squeezing a tube of toothpaste, pushing all that pooled blood upward towards the heart. And this immediately reduces the venous pressure in the lower leg and prevents stagnation. The beauty of this move is that it is simple, but no one would even notice it. You can do it while teaching in a class, or standing at your kitchen counter, or even while you're working at a cash register, or even inside an operation theater, which, by the way, I personally do between surgeries. But here's a question for you. What if you're in a situation where calf raises aren't possible? That's where number 2 comes in. And move number 2 is ankle pump and circles. If you can't do calf raises at that moment, at least move your ankles. Lift one foot slightly off the ground and point your toes upward towards your shin, and then push them downward, back and forth 10 times on each side. You can also slowly rotate your ankle in circles, 5 times clockwise and 5 times counterclockwise. Now you might think that this is too small a movement to matter, but these movements engage the smaller muscles around your ankle and foot, muscles that help pump blood from the lowest point of your body. And some people would have noticed that by evening your ankles look puffy, and the swelling is actually fluid leaking out of your high pressure veins into the surrounding tissue. And that's where regular ankle movement does improve the foot and the leg muscle pump also, and hence the venous and lymphatic drainage. So now moves 1 and 2 are about active pumping, but there's a common standing mistake that almost everyone makes, and it silently kills your circulation. So move number 3 is that you should stop standing with locked knees. This is something which I see happening so often with people all around us, and they have no idea it's a problem. When you stand perfectly still with your knees locked straight, your muscles essentially shut down. Zero contraction, zero pumping. So blood actually pools rapidly. Instead, I want you to consciously shift your weight from one leg to the other every few minutes. Gently bend one knee, then the other. You can actually rock slightly side to side, or even front back. These micro shifts will help to keep your calf and thigh muscles engaged. Think of it in this way. Static standing is the enemy, but dynamic standing is the solution. Even the smallest movement changes everything. Now the moves 1 to 3 can all be done without leaving your spot, but the next move requires to break free for just 60 seconds, and it's incredibly powerful. So move number 4 is to take a short 1 to 2 minute walk every single hour. You may walk to get water, you may even walk to check out something, walk to the washroom. It doesn't matter where you walk. What matters is that walking activates multiple muscle groups in your leg, the calf, the thigh, the glutes, all at once. It's like pressing the reset button on your circulation. And this is not just my opinion. Multiple studies have clearly shown that interrupting prolonged standing with even short walks reduces the leg discomfort and swelling far more effectively than just standing with occasional stretching. Now here's a practical tip. Set a silent alarm on your phone every 1 hour. When it vibrates, that's your signal. 1 minute of walking, then back to work. Simple, realistic, but extremely effective. So far, these 4 moves protect you during the workday. But what about recovery? What do you do after you've been standing all day? And that's where moves 5, 6, and 7 come in. And move 6 contains the mistake I mentioned earlier that most people get it wrong. Move number 5 is elevation. The moment you get a break, whether it's lunchtime or you're finally home, sit down and get your legs up. If possible, above the heart level. Put them on a stool, a chair, or a sofa. This works so well because gravity has been pulling your blood downward the whole day. Now you are actually reversing it. You are using gravity in your favor. You are allowing gravity to help the blood and the fluid to drain back towards the heart naturally. Even 10 minutes of leg elevation during a lunch break can make a noticeable difference in how your legs feel by the evening. And at home after work, lie down, put your legs up on 2 or 3 pillows, or you may even try the legs against the wall, which I recommend in many of my videos. Think of this as a recovery period your veins need after a full day of gravitational stress. Now move number 6, and this is the one I warned you all about. When people think about preventing varicose veins, they think about exercises and compression, and nobody thinks about what they are eating and drinking. This is a problem. When you are dehydrated, your blood becomes thicker. Thicker blood moves slower. Slower blood pools more easily. So if you're standing all day and not drinking enough water, you're actually making your circulation worse. And here's the part where most people get it wrong. It's about salt. Excessive salt intake causes your body to retain fluid, but that fluid actually goes straight to your ankle and lower legs. So the fix is increase your water intake throughout the day and be mindful of hidden salt. Hidden salt can be in any food items these days, packaged foods, processed snacks, pickles, or even canned soups. You should be mindful of what salt intake you are consuming. These 2 changes in your diet can help reduce your ankle swelling significantly, sometimes within days. Now the final move in this survival plan is something many people have heard about, but they use it incorrectly. And move number 7 is compression stockings. If you stand for more than 6 to 8 hours daily, or you are seeing signs of varicose veins even in the early stage, then compression stockings are one of the most medically proven tools available. But here's what most people don't know. Not all compression stockings are the same, and wearing the wrong ones can actually do more harm than good. Most good quality medical grade compression stockings apply graduated compression. By graduated, I mean that the pressure is highest at the ankle and gradually decreasing as they go up the leg. This design supports your vein walls, improves the valve function, and pushes the blood upward. The right compression level, typically between 15 to 30 millimeters of mercury, would depend on your specific symptoms, and they should be ideally seen by a doctor and prescribed after proper assessment. Class 1 or Class 2 are the compression stockings which are fairly used worldwide for this purpose. But timing also matters. Put the stockings on in the morning before any swelling starts and take them off at night. If you want to know more details about stockings, how to choose the right one for your specific situation, I already have a dedicated video on that topic. So let me summarize your 7-step standing survival plan. Calf raises, ankle pumps, stop locking your knees, walk every hour, elevate your leg on breaks, fix your hydration and salt, and use proper compression stockings. But I want to leave you with something important. Even if you follow all 7 steps, some people will still develop vein problems due to genetics, hormonal changes, or years of standing. That's why prevention must always be combined with awareness. If you notice swelling, or your veins are becoming more prominent or bulging, or you see that your skin starts darkening or itching, these are warning signs of chronic venous pressure. And if you ever have sudden swelling in one leg with pain, warmth, or redness, that could be a blood clot and you need to see a vascular surgeon urgently. Standing for long hours may be part of your job, but vein disease does not have to be part of your future. Share this video with anyone you know who stands all day. It could be a friend, a relative, whoever. Help them with this 7-step plan. I am Dr. Sumit Kapade and I'll see you in the next video.